Just a second.
You are live.
Greetings, Annapolis. We want to thank you all for joining us today. We are here with an esteemed panel of policymakers, as well as practitioners and those who work with populations that are impacted by COVID. Today's subject matter of our virtual town hall is on the senior population. So that population of Annapolitans who are the age of 50 and older, but who also have been deemed a greater risk in terms of the opportunity to contract COVID-19. So today what we've done is we've taken this opportunity to have our policymakers, namely Mayor Gavin Buckley and Alderwoman Sheila Finlayson, who is the representative from Ward 4 and is a long-serving member on our city council, to hear from not only our constituents and those who live in the city of Annapolis and parts of the county, but also engage in conversation around ways that we can provide information, connect our citizens to services, but also provide some useful tips and some experiential words of comfort and other things to our listeners. And this is another way for us to connect with those people who are impacted by COVID-19 in the city of Annapolis. One of the things that we do know is that this population is a population, as I said, that needs not only information, but to know that they are thought of and cared for, not only by their family members, but by their neighbors, by their mayor, and by their city representatives, such as our Alderwoman, Sheila Finlayson. So what we ask is, as we move into this, that those who are viewing take this opportunity to comment, to ask questions. We will pull your questions from our page, and we will ask these questions of people that are on our panel. So I want to start by introducing our esteemed panelists, and we have Mayor Gavin Buckley. How are you doing, Mayor Buckley?
All good, thank you.
All right, we have Alderwoman Sheila Finlayson.
Hello, thank you.
All right, and we have Wayne Taylor, who is chair of the Commission on Aging for the city of Annapolis, and he also does a lot of work with the county of Anne Arundel. How are you doing, Mr. Taylor?
Good afternoon. Good afternoon, sir.
All right. And we have Deneen Richmond, who is Chief Quality and Population Health Officer for Luminous Health, and she also does work with Anne Arundel Medical Center, which is an important hub for the city of Annapolis and the county. How are you, Ms. Richmond?
Hi, good afternoon, everybody. Happy to be here.
Thank you for joining us. And we also have Janet Farnham, who is a resident, and she is a senior citizen, and she is very knowledgeable about the experiences of living in communities that are predominantly senior citizens, but those who are active. And, you know, a lot of the stereotypes that we have about senior citizens is that they are kind of stuck in one place and they're doing specific activities. But as we all know, that population is, you know, exactly like every other population. They have the same interests and the same access to things. So thank you for joining us today, Janet. Can you hear me, Janet? You're muted.
As you directed, I'm happy to be here.
All right, there we go. So let's jump right in. Again, this is our virtual town hall, City of Annapolis, focused on our senior population. So Mayor Buckley, start us off. You're muted.
Welcome, everybody. Thank you so much for being here. Throughout this pandemic, the key has been communication. We have tried to reach out to as many segments of the population to hear from them, but also to let them know that we are here. So good afternoon and thanks for joining us. I want to thank our panelists for taking time to talk about some of the issues facing seniors during the pandemic. But first, I'd like to take a moment to remember the long life of Aura Brown Snowden, who died earlier this week at age 104. Mrs. Snowden is a longtime Annapolis resident and is the late mother of Carl Snowden, our civil rights activist. I lost my mum earlier this year, and I know how painful this loss is to Carl and to his extended family. And my mum was at the senior center. Thank you, Wayne Taylor. The city staff and our residents, as well as my wife, Julie, are extending our deepest sympathies to the Snowden family. At this moment, could we just take a little moment of silence for Aura, please? Thank you. The reason for this town hall today is to discuss the impact of COVID-19 on senior citizens. There is probably no age segment that has been more impacted by this pandemic. While young people are missing things like graduations and birthday parties, our older residents are dying when they're hit by this highly contagious virus. In Anne Arundel County, there have been no deaths in the more than 3,500 positive cases in individuals who are under 40. At the same time, of the total 154 deaths that have occurred, 85% of or more than 130 people were 70 plus in age. So among senior citizens, this virus is a very serious business. And as we begin to reopen our city to commerce, it will be critically important to do the things that will slow the spread of the virus. Those things are, we've heard them 100 times, wash your hands frequently, use hand sanitizer. If you go out, wear a mask or face covering, even if you're outdoors. One of our struggles downtown, right, Sheila? Please practice social distancing. We're doing the best to get this message out, because if everyone could do these things, even people who aren't facing the same high risks, if we can get people to do these things, we will all live in a safer world. As you know, we share a Department of Health and a Department of Aging with the county. A couple of things to remind you about. Fresh Food Fridays provides boxes of produce to anyone 60 years and older. Pickup is between 2 and 4 p.m. The next one is May 29th at 2666 Riva Road in Annapolis. The Department of Aging has a very active Facebook page and YouTube channel where they offer a number of daily programs, including fitness and lifelong learning initiatives. It is important to keep your body and your mind active while we're all shut down for the pandemic. Be aware of COVID-related scams and schemes. Bad people are always trying to find an edge, and there is no better time than a pandemic when folks are stuck at home. Don't give out unsolicited personal identification information, including bank numbers or credit card details. If they call and they claim they are government or a bank or feeding the hungry or whatever, please get phone number and an email and take time to check them out. on the Maryland Attorney General, the Maryland Department of Labor and Federal Trade Commission's websites. And lastly, I'm sure our hospital liaison will talk about testing. But I want to let you know that the Department of Health is offering free COVID-19 testing to anyone who wants it. You don't have to have symptoms to get the screening, but they do ask that you have an appointment so they can keep people moving and maintain physical distancing. Our next testing in the city is Monday at Pip Moyer Recreation Center. The number for that is 410-222-7256. I'll say that again. That is 410-222-7256. And thank you so much. I will pass this on to the next person. Thank you, William.
Thank you, Mayor. Very useful information, and we will check back with you as we go through, because there are questions and a few things coming up that I think you may want to jump in on. So next up, we have Alderwoman Sheila Finlayson, who is joining us on the panel today. Alderwoman, how are you?
I'm pretty good, Will. How about you?
I'm great, thank you. I'm great, thank you.
Want to say, first of all, thank you for putting this town hall forum together, because as the mayor mentioned, communication is key. And sometimes our seniors don't feel as if they're connected. As many of you are probably aware, the Bates Center sits in my ward. And so it has been a soft spot in my heart for the last 20 years or longer. And so I have worked very hard to make sure that our seniors are taken care of. And during probably my entire tenure on the council, I have made sure that we have things in place to address their needs and sometimes to predict what they may need in advance. For example, our Office of Emergency Preparedness has worked with every single staff in every one of our senior buildings to make sure they have an action plan so that if there is some sort of a tragedy or some sort of a problem, we know how to respond and they know how to respond. So we have been proactive in many, many issues as it relates to seniors. Currently, we have a senior assistance roster. After we shut down back in March, I spent 2 days in the Emergency Operations Center calling a list of about 100 seniors just to say, how you doing? Do you need anything? We're here for you. You know, use this number if we can help you, to keep them connected. And I can tell you, I didn't get anyone who needed anything, but they were all extremely appreciative that we were calling them and we were checking up on them, simply that we were thinking about them. So, you know, I am very proud of what the city is doing to make sure that our seniors are taken care of. And it is ongoing. You know, every Friday, the mayor mentioned one food giveaway through the county. We have a Food Friday. And during Food Fridays, not only are families who have applied and received a box of food, receive their foods at that time, but the seniors also get boxes of food. So, you know, we know that there is a problem with food shortages in the city and everywhere. So we're addressing that through the Food Fridays. So I'm probably overstepping my time, but the city has many, many things, and we'll talk more about what those other issues and other programs are to try to reach the seniors. But the bottom line is that we are working very hard to address their needs, but we'd like to hear from them. Tell us what you need and what we could be doing better, different, and more of it. So, thank you.
Well, you are not overstepping your time, and every word that you've spoken is useful. So thank you for sharing that information with us. And I know there's so much that you could share with us, and so thank you for that. And there'll be an opportunity to answer some questions and to speak more about those things. But I want to just touch really quickly on what you said, which is also recognizing that when we talk about the senior population, we are talking about some of our more experienced and wiser group of people in our city who have this wealth of built-in knowledge based on their living experiences and how much they know about our city, and we should honor that. And so I think to your point about what the city has done and the response that you all have done to this, yourself, the mayor, and all of your colleagues on the city council, as well as Chief or Director Kevin Simmons, is to be commended because they are pulling from that knowledge base. So thank you for that. And so next up is Wayne Taylor, who, as I said, is chair of the Commission on Aging and is consistently and constantly working on this subject matter, even as we just have this this town hall today. This is an everyday thing for Mr. Taylor. So Mr. Taylor, how are you today?
Good afternoon. First of all, I just want to say that as I'm speaking, I'm going to be speaking from many different hats. And when I say that, as Will mentioned, I am the chair of the Commission on Aging for the City of Annapolis, but as well as I sit on the area agency on aging for the Advisory Council for the County Executive. I'm the former director of the Department of Aging and Disabilities, and I'm also vice chair of the Anne Arundel Democratic Central Committee. So when I'm dealing with residents, and especially our senior population, I'm dealing under many different forms and fashions. Today, when I am talking, I'm going to be really talking about 5 different senior residents that are here in the city. These are the central focus for the Commission on Aging. Each one of my commissioners they actually go into these particular residents, and quite simply, they act as emissaries for us. So they're like ambassadors for the commission and for the city. So those residents are the Bates senior residents, the Bowman senior residents, the Morris Blum senior residents, the Baywood and the Baywood Forest and the Bay Forest, which are off on Edgewood Road. So we actually function in each one of these. We attend their meetings. We discuss the issue, and we also funnel information back from the Department of Aging, because we have an extremely great relationship with Pam Jordan and the Department of Aging. And so in essence, the open hand is always there. If there are any needs for our seniors here in the city, the Department of Aging is there and ready to help.
All right, thank you, Mr. Taylor. And again, we will get back with you because there's a wealth of information that I can detect that you have to share. So thank you for that. Deneen Richmond, as I said, who is Chief Quality and Population Health Officer and with Anne Arundel Medical Center and Luminous Health. How are you?
Hi, good afternoon. How's everyone? So good to be here. So first, I just want to share that we are thrilled with the partnership that we have been receiving from the City of Annapolis, the Mayor's Office, the Health Department, many other community groups and governmental agencies. It really is a village. It takes a village, I should say. And we definitely view ourselves as part of that village to really make sure we're caring for our seniors in Annapolis and the surrounding areas. So Anne Arundel Medical Center, I think many of you hopefully are very familiar with us. We actually are the 3rd busiest hospital in the state of Maryland. And some of you may not be as familiar with Luminous Health and hearing that name, but last year, Anne Arundel Medical Center and Doctors Community Medical Center, which is in Lanham, Maryland, and Prince George's County, came together to form Luminous Health. So some things change and some things have not changed at all. We are still very much community-based and view ourselves as an important part of the community and really want to be here to keep people healthy as well as to provide care and help you to get well when you're sick.
Thank you. And I believe you have some information that you want to share with people on your presentation. Can you hear me?
Yes.
Okay. So do you want to begin that now?
Sure, that would be fine if you want me to go ahead and do that now. So
Yes.
Mr. Rao had asked me to put together a few slides. So I'm going to hopefully not take too much time, but just want to share a few things. So when I said we're here, I do want to just reemphasize that we are safe. And I want to make sure people understand that because we know some people have lots of other health conditions and they think it's not safe to come to the hospital, but we are safe, ready, and open. If we can go to the next slide, please. So there's a lot of misinformation that's out there, and this doesn't even cover all of it, but I want to just hit some facts. I want to talk about some truth statements here. So we know, truth number one, that this virus is not sparing anyone. All ages, races, ethnicities are being impacted by COVID. And as Mayor Buckley was sharing, we are seeing a disproportionate impact with our seniors. So you are a very important group that needs to hear some of these messages. We know that sometimes people feel well, but they still may be spreading COVID. And we use medical terms like asymptomatic, but I want to keep it simple. So what we really are saying is that you may feel perfectly well, but you may have it. So once again, just reiterating that message of how important it is to do that great hand hygiene, practice social distancing, wearing a face mask or a face covering when you're out and about. And then we hear some people say that truth number three, that, well, I'll get better. I'll, have that tea and lemon juice. Obviously, we don't want people drinking too much alcohol, but I want you to know that these things will not prevent COVID. So yes, they may make you feel better, but it will not prevent COVID. We also think people think, this is not something that you can wash away once you are infected. So while hand hygiene is important to prevent you from getting infected, and wearing the face mask and the social distancing, taking a hot bath will not kill it. It does nothing once that virus is inside your body. So you need to stop that. And then just reiterating, hospitals are safe places to go. If you have COVID symptoms, we definitely want to hear from you. And for all of those other things, we know people are still having heart attacks and stroke, and we are safe and ready and there to serve you. If we can go to the next slide. So I think I heard Alderwoman Finland say, we got to remember to keep our minds and bodies healthy. So I'm not going to read everything on here. You can see, I'm just going to point out a couple of things, but this is so important. And we know right now people are, in their homes. You may be isolated, not spending that time with your family and friends as you normally would do, not able to get out. So if you can do it safely, please do get outside and enjoy the fresh air. Open your curtains, let the sunlight in. Take that warm bath. Like I said, it won't prevent the virus once it's there, but it will make you feel better. We know how relaxing that can be. Take deep breaths, catch up on your favorite movies and TV shows and books, and talk to your friends. Just because we may not be able to be together, even like how we are today, having those virtual connections, picking up the phone, staying connected to people is so important. Next slide, please. So maintaining your health has never been more important than it is right now. So once again, if you are sick, please don't delay getting care. We are seeing people come into the hospital who have stayed at home way too long, suffering, and then they are now sicker than they may have otherwise been. We are also offering, for those who want to just feel like you want to talk to somebody first and figure out, what's the right way to connect and get care. We have free virtual visits that are available through our platform that we call Care Connect Now. You can see some of the types of things that would be very appropriate for you to call us about. This is not an exhaustive list, so if you have any doubt, don't hesitate to call. We have people available. Our providers are there Monday through Friday, 8 a.m. to 9 p.m. And then on the weekends, Saturday and Sunday from 9 a.m. to 7 p.m. And if you can contact us and we can do a video visit and see you and understand your symptoms and talk to you. And I'll just say the number 443-951-4270. I'll just repeat that one time just in case people aren't able to see the screen. And that's for Care Connect Now, 443-951-4270. We can go to the next slide. So if you have a serious illness, we don't want you to call us. We want you to call 911. And we want you to be comfortable and know that you can come to the emergency room and be safe. As I mentioned, don't put your health at risk. We want people to stay healthy. We have a number of safe measures in place. We can talk about those a little bit later, perhaps. And then these are just some of the symptoms where you should be evaluated in an emergency room setting. So obviously, if you're having serious heart pain, if you had seizures or chest pain or weakness or numbness, difficulty speaking and slurred speech, or you're fainting, or our mental health, if you really are feeling like, you don't feel like you can make it any longer and you're concerned, have those feelings of suicide or harming yourself, we definitely will want to see you and help you and get you the care and service that you need. Next slide, please. So just want to put in a plug, because we're talking a lot about COVID, but we really care for our seniors always. You are so important to us. You have that lived experience, and we want to keep you around as long as possible. So some of the things that we do to really have that focus on our seniors at Arundel Medical Center, we have an Institute for Healthy Aging, and we are one of 5 pioneer health systems, original of pioneer health systems in the entire country that adopted what we call an age-friendly health system. And so we're funding from the John Hartford Foundation and the Institute for Healthcare Improvement. We focus on our seniors. We talk about 4 M's, what matters to you, your medications, making sure you're on medications that seniors shouldn't be on, or too many medications that may be interacting with each other, your mentation or keeping your mind sharp, and your mobility, keeping you moving. So want you to be aware of that. That's our focus always, not just during COVID. We have a dedicated hospital unit, the acute care for the elderly. We have special accommodations that we make for seniors, staff that have special certifications to take care of seniors, and a number of activities really to make sure that we can best meet the needs of our senior population. And then we do a lot of senior community outreach and have really stepped up those efforts during COVID. We've been out and about in the community in Annapolis. We've been to a number of those senior residences that Wayne Taylor just mentioned, Morris Blum, Bowman Place, Bates Apartments, and many, many other places that we have been, just really making sure that the management teams there know what they can be doing, that the residents know what they can do. And we have these COVID care packages that we go door to door, just check on people, make sure people are okay, connect them to resources, give them face masks, face coverings, cloth masks if they don't have them, laundry pods and other things like that. So thank you again for the time. I'll chime in later, but just wanted to share these things to make sure everyone was aware that we are safe, ready, and open at Arundel Medical Center, and we are part of the community, and we care, and we want to help you stay healthy and help you get well if you do get sick. Thank you.
Thank you so very much. That was very useful information. And again, there are some questions that have come in that I want to pose to you as we move forward. So Janet Farnham, I can't hear. I think you're muted. I think you have to oh, there we go.
Yeah.
All
I got
right.
it.
How are you
So
today?
hello, everybody. I'm the living example of what you're talking about. I'm Exhibit A. I live in Baywoods. I have for 2+ years now. My academic background is in policymaking. So I'm very interested in who makes the decisions and how the decisions affect people. The last 10 years, when I was still in New York, I was involved in the New York State prison system. So I know how large systems work and don't work to some extent.
Okay. Thank you, Janet. So what we'll do now is we'll move into some questions from people who have viewed. I want to jump to the mayor so he can jump in with any comments he has right now and observations. Mr. Mayor? I think you're muted.
I apologize. I just was getting a question from the side. What was the question again?
Oh, I was just inquiring whether you had any comments or any observations you wanted to make before we move into Q&As.
Oh, no, I'm looking forward to some questions.
Okay.
Sure, yeah.
All right, well, I'll start with you.
Just to say, everyone, I miss my mum, so I'm looking forward to talking to some mums.
Oh, there you go. So one of the questions that I had from one of the viewers is in reference to area code 21403, which I'm familiar with because that actually appears on my mail because I live in Eastport.
That's mine.
There you go. See, so one of the questions which I had heard about in terms of that particular zip code being highly impacted by COVID-19, and there's another offshoot question around that came from Judy Buddensick, who we all know, about so many people sitting outside of like Davis's Pub or across there with to-go food and cocktails and things with no face masks, no social distancing, and how that has impacted not only that zip code, but how are our seniors faring in that particular zip code? Do you have any observations on that? I have a few, but I want to give you the floor.
So the two highest zip codes are 21401 and 21403, and we rotate between Glen Burnie, I think Pasadena, that it's kind of been moving backwards and forwards. So it is a serious issue for our city. The zip codes are not solely in the city, they spread out of the city into the county. We've been trying to get a breakdown of that so that we can drill down and put the resources where they need to go. We have been bringing resources into the community, whether it is food drives or whether it is COVID testing in areas. And then we've been knocking on doors to let people know they can come out and get a test. So we've been trying to ramp up the testing. I've been pitching for that for day one. I really think we can't get to the other side of this until we really know what we're dealing with. And so we have increased testing. But what's interesting, I just noticed today that there is a lot more increased testing, but the numbers are not getting worse considering the amount of testing that's happening. Now, that just might be a lull for now. I feel like we have to approach this slowly. Team Maryland has been doing a good job. And the governor's been doing a great job. The county executive's been doing a great job. And I'm very proud of the work that the city has been doing to this point. But we don't want to ruin it. So we have to move forward gradually. On the people sitting outside without masks, I'm as frustrated as the next person. It is disrespectful, and it's not about yourself, but it's about the people around you when you think about wearing a mask. When we calculate less than 20% of people are wearing them, and obviously not always observing the social distancing. You'd have to be living under a rock to not have heard those things. Keep 6 feet. Don't wear a mask, even if you're outside. all the things, wash your hands. I mean, we yell it from the rooftops. We put it on flashing signs on Road Boulevard and Eastport as people come into town. We put it in the middle of the city dock. We employ friendliness ambassadors in this last weekend and next weekend coming up to hand out masks for free, suggest people keep their distances, tell people that over 10 people gathering is a de facto gathering. It's not really allowed under the governor's orders. But the challenge is personal responsibility.
Right.
You know, how, and a lot of people come to this city because it's a state capital, and they come to make a point, and they come with different political persuasions and different philosophies, and that is our challenge, and how we manage them and how we you know, make them see reason, I'd say.
Absolutely. So this question was also posed to Wayne Taylor.
I don't want Kendall Charles.
Right.
I'm
So
sorry,
this question.
Listen.
Right. So this question was also posed to Wayne Taylor, and I'll add. I know you have something to add to this, Mr. Taylor, but there's also a second part to that, which is how are senior citizens faring who live in public housing?
So let me share with you in regards to the 5 residents that I brought up at the beginning when I initially came on. I do know that all residents currently, if you're non-essential, meaning that you're not related to any of the individuals who are there at that particular residence and you have no other business there, it is asked that for you not to enter or come to the building. Now, at Morris Blum, they have what I consider to be a gauntlet. When you walk through the door, you have to end up in front of the office of the manager. And so the manager is questioning you as to what is your reasoning for being there. And so at the Bates facility, very similar. At the Bowman House, when you come in the door, you are right there at the manager's office. It's the same way. I know at Bay Woods, you cannot come in Bay Woods unless you are you work there or you are an invited resident. And I'm sure it's the same way at Bay Forest, except there are other interests coming into those. You want to know how our senior residents are faring in our public housing. So they, for the most part, our seniors understand this whole concept of how this virus is contracted, how you can get it. And so they are following, for the most part, 99% of the seniors in which I've come in are following this to the letter in regards to face masks when they come out into the hallway. They do not congregate in the facilities. And so in essence, I think that our seniors are faring well. You know, currently we, and correct me if I'm wrong, Mayor Buckley and Mr. Rao, but I believe we only have one senior assisted living facility in the city, and I think that's Genesis over on Hilltop. And so I know that they are on that same lockdown type of way and operating under that same premise that if you don't have business there, don't come there.
So thank you much, Mr. Taylor. And I know Alderwoman has something. I'm sorry, Janet, really quickly. So the Alderwoman had, I saw her trying to make some comments. Make sure you're not muted, though.
My turn?
Sorry.
No.
To follow up on what Wayne was saying and the mayor, our seniors are following the recommendations. We have only had, and 2 is too many, but we've had 2 deaths amongst our seniors in our city. And we've had no deaths among staff within our facilities.
Okay.
So that is a good sign. And if you look at places, hotspots like Glen Burnie, we are way below the bar there. So seniors are paying attention, and Wayne, Mr. Taylor is absolutely correct. You cannot go into these facilities now. And unfortunately, staff members have a higher percentage of cases in those facilities than the actual residents. So, you know, it's still a matter of making sure that everyone follows the rules, and that even staff follows the rules and are protected, and thus protecting our seniors.
Absolutely. I wanted to pass it over to Janet, who I think was attempting to comment. Janet, did you?
Yes, I wanted to say that by definition, the senior communities are very porous. We're reliant on so many workers, whether they be nurses or simply aides or in the dining facility or whatever. Even though the seniors themselves, we can be doing just what's been described, all of these other people of necessity are coming in and out. And that's usually how the COVID first enters the facility.
So
I can say that we every 2 weeks, our Office of Emergency Management has on our team leader calls the heads of all the senior centers and the assisted livings in the city of Annapolis. I think it's 8, and they are conducting themselves excellently, and they are managed well, and we're really proud of the work that they've been doing. And they went straight to lockdown. They realized what was happening, and they mobilized fast, and it's a credit to them that we have kept things as good as they are, and it's because of good management in these centers.
Absolutely. So thank you, Mayor. I did want to add that I visited myself several of these facilities, and even in doing so as recently as today, I think what's being highlighted also is that a lot of the issue are those of us who are bringing these things to our populations that are most at risk. And so even as we have this conversation about behavior and individual behavior, remembering that a lot of this behavior isn't so that people like myself don't get it. And I think that's what's happening, right? Like we're thinking, oh, it's my choice whether I get to wear this mask or whether I, engage in these activities, because it's whether or not I get it and how I take care of myself. When the truth of the matter is we're actually doing and engaging in these safe behaviors because we want to be sure that we're protecting our family members and we're protecting people who are at higher risk for getting it, such as our senior population. So that's what I get out of this also. And I wanted to use that as a segue to a very important thing that I know we're all grappling with is, and I want to pose this to Janet first, which is how can family members and how can those who want to help and assist those in senior living, but also our older family members, how can those of us help them without putting them in harm's way?
Well, it begins with what I call digital privilege. This is, of course, a huge issue in economically deprived areas, but for older people, a lot of us don't use digital equipment easily, and a lot of them don't even have iPhones. So if the family can help them adjust to using this kind of equipment, that's always a good thing. But for some of them, they're never going to want to do that easily. So the telephone is a great thing. Yeah, I have been on Zoom and Teams and Skype for the first time in my life. I'm on the board at Baywood, so we meet via Teams, et cetera, et cetera. It's a new life. But most seniors need help with that sort of thing.
So I'm gonna pass this over to Wayne Taylor, who wants to speak on this as well, but I wanted to put in this one fun fact and interesting thing, if we can liven it up a little bit, is that our sister city happens to be the international and global hub of Skype. And I don't know if a lot of people know that or knew that, but the city of Annapolis' sister city happens to be where Skype lives, which is interesting when you think about technology and you think about where we are right now. So that kind of puts us on someone's map, if not our own map, right? So, Mr. Taylor?
So, in talking in regards, piggybacking on what Janet just mentioned in regards to our seniors and technology, there's no question that once our seniors get engulfed or they get attached to something, that is how they navigate. And I'll give you an example. When we talked about the mail-in ballots and the ballots being mailed to the homes and the ballots being mailed out, our seniors have been used to getting sample ballots. They're used to going to the polls. And so they're seeing a sample ballot and they think the ballot that they got is a sample ballot and they put it to the side. And so what I have found in going into and talking to a lot of our seniors in regards to this new voting experience for them is that they have done just that. So it's one of those constant rehearsals and going over that information over and over again, and quite frankly, and they get it. So new things, they do get it. They get attached to it, and they run with it, no question about it. My fellow commissioners, we all still struggle with getting on Zoom, and we still struggle on using these new smartphones. But at the end of the day, we make it happen, and we get that, make sure we get across that finish line in regards to communication.
Thank you so much, Mr. Taylor. I wanted to jump to Deneen really quickly, because I know she talked about the communities that they visited and what's happening in communities. And one of the things we're faced with is how do we actively and in real time get information to some of these communities and your experiences around healthcare and access, and them to be able to access those services?
So I think that one of the things that we recognize is that it can't be a one-fit-all approach, that we really try to reach out in a lot of different ways. So we get advice, for example, we have patient family advisory councils, and they are so helpful to us in helping us to connect. They can serve as personal connections themselves, and give us lots of tips and pointers about how to reach out to people. During COVID specifically, during this period of time that we're all facing, the stay at home, and even though those are being lifted, we found that we had to get outside of our walls and go right to where people are. So we have been going to food distribution sites, and handing out masks and education and other things. So it's all about going where people are. And then specifically for our seniors, because we know so many of them, rightly so, are staying home, we have been going to their homes safely. I want to make sure I say that, safely. So, no contact visits, but being able to, once again, sometimes we may knock on the door and they talk to us through the door, and we leave some information right there on the door. And other times they open the door and we're wearing our face mask and making sure we are staying 6 feet away from them and sharing some of that information, and sanitizing our hands in between each door that we knock on. All of those things that we're asking everybody else to do, we are doing. So it's really that multi-pronged approach, reaching out to trusted sources that can share our message, going to places where people are, and then going directly to our seniors in their homes.
Okay, and I want to liven this up also by saying we happen to have a person who is a I mean, we're extremely lucky to have a professional pickleball athlete on this panel. And I mean, you know, he's an international star on the pickleball circuit, and he happens to be our mayor. And I know he's been working diligently, in all seriousness, he's been working diligently for us to be able to provide outdoor physical activity for people that's continuous, right? That happened before we, you know, jumped into this pandemic. And that's the mayor. And, you know, a lot of his focus has been on trails and biking and also pickleball. And I know right now it's been really hard for him because he plays pickleball like 5 o'clock every morning, you know, on a team. And, you know, so Mr. Mayor, how's that working out?
I have a lot of friends that I play pickleball with, and there's a lot of a cross section of ages. But I do think it's vitally important to have facilities for people and to have an active community. And having an active community means you live longer, you know. So I love the Bates track because I see people old and young, rich and poor, black, white, Latino, all sharing in these facilities. And if you build good recreational facilities that everyone can share, you build a better community and you build a healthier population. And I think that a big part of health is getting outside. Mental health and physical health are so important. And we have such a beautiful city. My goal has been to try to connect it instead of building fences, to build bridges to connect areas, to make safe trails that are just for walkers. Or the one thing positive that can come out of this terrible virus is that more people are discovering parks in the city and in the county that they didn't even know we had. More people are walking and biking and running, and whatever speed you do it at, it doesn't matter as long as you do it. And so I've really been enjoying watching that happen, and I hope that we continue those habits, make our city less car-centric and more people-centric as we get to the other side of the pandemic. But thanks for the pickleball diss.
All right. Thank you, Mayor. And so I want to remind all of us, those who are viewing, as well as our panel, that the mayor has a hard stop because he has to jump into another meeting. And I also want to take this opportunity to thank our alderwoman, as well as our other alder persons who, whether or not you all can see it, because I know this, you know, we're kind of all detached based on this pandemic, but they have been working from wherever they are, you know, diligently in, you know, for city business in terms of the budget, in terms of reallocating things to be sure that you know, Annapolitans have the things that they need. So even though they may be out of sight in some way because they're not as visible because of this pandemic, I can attest that they've been working overtime on city business. So thank you all, you know, on this format for the work that you all have been doing, Mayor and Alderwoman and your colleagues. So if the mayor disappears or falls off this, I want to remind you all that it's because he has a hard stop for a meeting following this. Alderwoman, I saw that you might have wanted to say something.
Yeah, I was going to make a plug for our next testing. I don't know how far we are towards the end, but today we did testing at Morris Blum. And on Monday, we will be at Pitt Moyer. And then the following Monday, we will be in Annapolis Walk. And so if any of the residents, and it's ideal to have an appointment, but it's not necessary, it's not required. And if transportation is needed, then please call OEM and they will arrange transportation through Transportation Department. So we're going to make every effort to reach everyone where they are. Oh, it's already on. Yes, it's on.
Yes, ma'am. So we put it up here for those to see. The font, it's a little small for people to be able to see, but the idea again is Pitt Moyer, the Deal Library, Edgewater Library. Those are Monday, June 1st, June 8th, Annapolis Walk Community Center, and Odenton Library. So there are opportunities to receive testing, and it's first come, first served. As the Alderwoman said, appointments are not totally necessary, but they are preferred, just so that they have an idea of the numbers and they can prepare for you. I want to add also that insurance is not required. If you have insurance, please bring your insurance card, but that should not stop you from coming to get tested. Okay, there's no cost to this if you're an Anne Arundel County resident. And you also don't have to have symptoms or a doctor's note. Is there anyone else on the panel? Oh, sorry.
May I also add that it does not hurt.
Oh, right. So that's a good point too.
Does not hurt.
Yes. So just,
I heard that today, and some fear from some of our residents. It does not hurt.
Absolutely.
It is not invasive at all.
So on that note, Alderwoman and Mr. Taylor, if there are people who need to see a doctor, let's say their normal appointments or checkups or things that they need to do that's out in the general public, how should they proceed with doing that safely?
Well, if they have a doctor,
yes,
they can call their own physician.
right.
If they don't have a doctor, I think that there is a registry, and Ms. Richmond can correct me, that the medical center has like doctors on call or something similar to that, where people can get attention for areas for which they're not covered.
That is correct. So if you have a doctor, definitely, because you have a relationship with that person and they have your medical records, give them a call. If you don't have a doctor, please call us. I mentioned our Care Connect Now, and I do want to also reiterate that is free. So there will be no charge, and that's 443-951-4270. And then I also want to mention that as part of Anne Arundel Medical Center, we have a couple of community clinics as well. And we will take people with no insurance. So we don't want money or insurance to be a barrier to anyone getting the care that they need. And we have one at Forest Drive, and then we actually have a clinic inside of Morris Blum. And if we have to arrange for transportation, if you can't easily get to one of our sites, just give us a call. We can help you with that as well.
Okay, and I want to. The mayor has to leave. I want to give him an opportunity to close out his piece so that he can smoothly move into his next meeting.
I'm sorry, I only have an hour today, but this is my fourth Zoom thing today. But especially just after Memorial Weekend, and as we see people descend on the city to reopen Maryland and all that, and that the thing that is based on this herd immunity thing, it's ridiculous. And it's so painful to see, because we know that principle means that some portion of your population is expendable. And we know that is affecting our seniors the hardest. Every single life matters. We have to fight for every single life. So we must keep everyone safe. It annoys me that people can even think like that. As we come out of a Memorial Day weekend, our parents, our grandparents, people who've been through wars have seen so much and teach us so much. So I'm love everyone that's watching. Thank you. Stay healthy, stay safe. And I'm sorry I have to leave. Thank you.
Thank you, Mayor.
Thank you, Mr. Mayor.
Bye-bye.
And thank you for helping to create this platform and keep it going. Mr. Taylor, I know you wanted to add something to that.
Well, I really wanted to chime in on what the mayor was talking about in regards to exercise and keeping yourself fit. I know that Pam Jordan and the Department of Aging is biting at the bit to get the Annapolis Senior Center back open and get it functionally up and running and getting our seniors back in there. We have a cross section of seniors who come to our senior center. And when I say cross section, we all are aware that the fact that, Annapolis is a small city with a broad base of individuals from very different forms of economical means. And so in essence, Our senior centers are flooded with these individuals, not just here in Annapolis, but throughout the county itself. And we're continuously having to map out opportunities to expand our senior centers because our senior population is growing. And, you know, folks like me, we are now, you know, we make a large number, us baby boomers. And so in essence, we are increasing those operations at the seam. And so in essence, as we come out of this, I am hopeful that there can be an opportunity to get more seniors over to our Pip Moyer Center, because I know that the director over there wants to really get seniors more involved. And one of the biggest problems that we have in the city for not just our seniors, but for quite a number of people is transportation, but more so for them. Because in essence, you know, to be on a bus and have to go around a circle in order to get to one destination, you know, it's like I might as well stay at home, because a lot of our seniors don't have that patience in order to do that. So in essence, one of the things that the commission suggested during the 10-year comprehensive plan was that, number one, increase free transportation and more direct transportation for our seniors. And that is to their doctor's appointments, that is to them to the pharmacy, as well as to the grocery store. This is so very important. But I'd like to see more of our seniors at the Pip Moyer Center. And you know, I'm not taking anything away from the Annapolis Senior Center, but if the opportunity can be there in order to increase the transportation and the availability to get there, I think they really would enjoy it, and the director over there would enjoy that as well. In regards to testing, when the opportunity rose a couple of weeks ago and you didn't have to have a doctor's appointment, I was one of the first ones down to the health department. And I can vouch for the comments by Alderwoman Sheila Finlayson. It doesn't hurt. They did a mouth swab, and 3 days later, I had my results. And I feel good, but guess what? At the end of the day, that didn't take me away from following the guidelines, following the process. I do a lot of transportation for our seniors. So our seniors call me, I go pick them up, I take them to the grocery store, I take them I take them to the bank, I take them any place they need to go. We practice safe distancing. I have my mask on, they have their masks on, they sit in the back seat like I'm a taxi cab driver. It's fine with me. I don't allow them to sit up front. We have the windows down. We're in good conversation. But at the end of the day, they feel safe because they know I clean my car and I keep my car wiped down. So after every ride, they don't have that trust in our cab systems and all these other things. So they feel real good in being able to get out and ride. And of course, I have my sunroof open and they enjoying the fresh air. So they're having a ball. So, you know, right. we all having fun here.
All right. So I want to, our time is up, but I want to, I just really quickly want to acknowledge a few people because I'm the person who's sitting here in the chair, but there are a lot of moving parts. And as you know, we operate in a huge ecosystem. I want to thank Mark Hildebrand for his work in enabling us to do this every time, and not just for this, but I want to thank Julian Jacques for the amazing work that he's been doing in allowing us to technologically be able to do this using his skills. I want to thank Mitchell Stevenson, who works with us in the city's entire communication system for the work that she's constantly does. Obviously, I want to thank the mayor for helping establish this platform, but also his leadership in doing this. Alderwoman Finlayson and our other alderpersons, though not here again, they are a vital part of anything that we do, and we only do it through their direction and their partnership. I want to thank each of you who are on this panel for taking time out of your day. And quite honestly, this isn't tongue in cheek and I'm not pandering, but your expertise and your knowledge as practitioners, but also experientially, is invaluable to anything that we do in this city. And we all are working on this together. So I want to let you all know that I personally appreciate it. But again, I'm a staff person who's fulfilling a role. And I thank you for helping us be able to do that as a city employee. And I want to just thank you all for your patience in the midst of all of this craziness, for doing so virtually, which is not always easy. So,
Well,
Alderwoman?
are we giving phone numbers where they can seek additional information?
Absolutely. Deneen, can you repeat that number again for the 6th time? But you know, it's never enough. It's never enough, right?
No, definitely want to make sure people have it. So it's Anne Arundel Medical Center Care Connect Now, and the number is 443-951-4270.
Okay, and I'll have Julian hopefully pull up our number that we do, the general number on the colorful one, as we roll out. We're done.
Maybe we could put these numbers on the city website.
Yes, I believe they're on there, and we'll make sure that they are on there. 410-222-7256. 222-7256. Well, thank you all, and have a good rest of your Thursday evening. And thank you all who tuned in until our next one, which will probably be in a week from today, next Thursday, our next virtual town hall. Stay safe, everyone. Thank you.
Thank you, Will.
Thank you.
Thank you.
Stay safe.